If you know how to answer these questions in the Viva, you are definitely the experienced one. Huh? Which book you are studying this from? Are you the author? Huh? How did you pass, man? How did you pass your first year if you don't know this simple anatomy?
Sir,
Acha,
I
tell me
just
which topic you have studied properly. I'll ask you
covered
questions
it,
from
sir.
that only. Hello everyone and welcome back to Physiotrendz. This is me, Dr. Prem Shah, and today's video we are going to discuss about the common Viva questions that can be asked from your first year to final year Vivas. It can be anatomy, physiology, X-therapy, electrotherapy, kinesiology, or ortho, cardio, neuro, or CBR. Any subjects, this question some or the other way might come. So listen to these questions very carefully, and if you are prepared for it, definitely you will have some answers to give in your Viva questions. The first question in my list is capsular pattern of shoulder joint or hip joint. Now, these two joints, capsular pattern, are very commonly asked whether it is anatomy subject or it is exercise therapy or it is MSK or ortho subjects. Why? Because if you are not answering all the advanced level of questions, your teacher is going to come back to the basic ones, and these are pretty common questions to be asked in basics. Second question in the list is diaphragmatic breathing. Now, diaphragmatic breathing can be asked in your third year cardio viva also. It can be asked for anatomy also, physiology also, exercise therapy also. And this question, I am telling you guys, very commonly is asked. Third and fourth question are my favorite questions. Third question is open kinematic chain exercises versus closed kinematic chain exercises. And if you are able to answer this question, then definitely the further question will be give me example of that, or your examiner will ask you, okay, tell me what type of exercise pull-ups is, whether it is closed kinematic or open kinematic. Do you know the answer? Let me know in the comments. And the fourth, which is again my favorite question, is screw home mechanism in knee joint. Now, this both the questions can be asked in your kinesiology also, it can be asked for anatomy also, it can be asked for exercise therapy also. And if you're not answering any questions in PT ortho also, these questions can be asked. Fifth and sixth question pretty much starts in your first year, but again it can be asked in second, third, and final year because it is basic. Fifth question is what is Erb's palsy, or maybe we can ask Klumpke's palsy. You should know that this comes in brachial plexus clinical anatomy and what happens in Erb's palsy and what happens in Klumpke's palsy. And the sixth question is about abnormal gaits. So abnormal gaits, anything can be asked, like simply give me example of Trendelenburg gait, or give me an example of hand to knee gait, or how does this gluteus maximus gait looks like. So demonstration of this gaits or what happens in this gait, what goes wrong in this gait can be asked in your first year, as well as kinesiology, as well as can be asked for musculoskeletal examinations as well. The seventh question is again starting from your first year but can be asked in final year PT neuro exam also, which is Babinski sign. What is Babinski sign? Whether it's a sign or it's a test. These are the further questions can be asked on this particular question. All right, next three questions. The first one is FEV1 by FVC ratio. Physiology can be asked, X therapy can be asked, ortho also can be asked, cardio also can be asked, but you should know what is FEV1, FVC, what are the capacities, volumes in lung. If you know it, you can definitely answer this. Last and final question which can be asked is about disability or impairment or handicap. So what is the difference between these three things can be asked. I know this is a little bit of higher level questions, might not come in first and second year, but it might definitely come in third and final year. If you know the answer, again, let me know in the comment section. And don't forget to subscribe Physiotrends for more and more such videos.